Hey guys, I am so sorry. I have no idea what happened. I don't know what happened. I was just talking and all of a sudden, I guess my internet tripped off or something. So, if you're still watching, thank you so much. I really apologize for that little break. It was not deliberate. So, like I was saying, insulin is the hormone that is responsible for driving glucose or sugar into the cells. So when we eat, what happens when we eat carbohydrate, for instance, we eat rice, the body breaks down the rice, and then the glucose from the rice is circulating in the bloodstream. But now, insulin is what enables the glucose to be driven into the cells where they're actually needed. So, but what happens when in a patient with type 1 diabetes, there is no insulin. So what happens? The glucose is just floating around the bloodstream, and that's why they have high blood sugar all the time. So in patients with type 1 diabetes, for instance, they have a total insulin, not no production of insulin, not even a malfunction. There is no production of insulin. So it means that they have to be on insulin, what do you call it, insulin replacement for the rest of their lives. Okay, so that one is an autoimmune disease. It's something that, I mean, it wasn't brought upon by the individual. Most times diet, exercise, whatever cannot really help. They just have to be on insulin, what do you call it, insulin shot or whatever for the rest of their lives in order to manage that disease process. The second type of diabetes is type 2. So in type 2 diabetes, pretty much the pancreas produces insulin, but the insulin is not enough. Yeah. So the insulin produced is not enough to drive all of that glucose that is in the bloodstream into the cells where they belong. So the individual has constant high blood sugars, and then sometimes the sugar is low and sometimes it's high. And this type of diabetes can be seen in anybody. Now, this is a kind of diabetes where your doctors want to tell you about weight loss, about appropriate diets, and all of that. The third kind of diabetes I want to be talking about is the gestational diabetes, and it is called gestational because it is most likely seen in pregnant women. It's called pregnancy-induced diabetes. So, in this form of diabetes, it's just about pregnancy. So you're pregnant, or you know a woman who is pregnant, and then she goes to the doctor's office, and the doctor says, "Hey, you have diabetes." And she tries to say, "Oh, but I never had diabetes before now. How did I come about this?" Yeah, it's called gestational diabetes. It means that due to the whole processes of pregnancy, your pancreas is not able to produce enough insulin to sustain to be able to manage the glucose in your body and sustain the pregnancy. All right, so I'm going to be talking next about, just a second, trying to make sure I have all my stuff together. Okay, so some of the signs and symptoms. Now, you don't know if you have diabetes. It's okay, but you probably have been having one or two of these symptoms and you're really concerned. You're really worried about it. You don't know what to do. You don't know who to talk to. And maybe you've gone to see your pastor, and your pastor has he has no definition, of your problem. You've gone to see every other person but your healthcare provider. Now, these people cannot help you. So if you're having any of these symptoms I'm going to be mentioning, you might need to go see a doctor as soon as possible. The three classical signs of diabetes is polydipsia, polyuria, and polyphagia. Classical. So polydipsia, excessive drinking of water. You just find yourself drinking a lot of water. And then polyuria, you keep peeing, you keep urinating, you pee a lot of times. If you're a man, it could be some other things, it could be some other reasons, but of course when you go to the doctor's office, they might want to first of all rule out diabetes. And then polyphagia, excessive eating. So people who are diabetic, they tend to eat a lot. So if you find yourself eating a lot, drinking a lot, peeing a lot, then you might need to go see your healthcare provider. Some other signs of diabetes include unexplained weight loss, especially with type 1 diabetes. the presence of ketones. So ketones are just byproducts of muscle and fat breakdown. So think about this. You have all this sugar in your bloodstream, and then the cells that actually need the sugar are being deprived of the sugar. So what happens? The cells begin to break down fat and muscles, to sustain the metabolic process of the body. So you find that when those patients urinate, there's a lot of ketones in their urine. It's just a byproduct of muscle breakdown. We also find fatigue, which is pretty much tiredness, irritability. They're, always irritable. Like, I mean, a hungry man is an angry man, So they're always tired, irritable. They have blurred vision. Have you ever gone a few days without eating? Yeah. Sometimes you feel like you're about to pass out. Excuse me. Yeah, so they have blurred vision. Now, basically, I want us to pay attention to this. Diabetics have slow wounds wounds that heal slowly or don't even heal at all. So if you have a wound that is taking so long to heal, it might be time for you to go see your doctor. Because think about it, microorganisms, germs like sugar, right? So if you have all that sugar floating around in your bloodstream, there might be a reduced tendency for your wounds to heal. I've had friends who have died of diabetic wounds, or wounds that couldn't heal because they were diabetic. So, but if you're able to identify some of these signs and symptoms, it can actually help you manage, whatever is going on in the long run. Now, I want to also talk about erectile dysfunction. So, this is an issue a lot of families have had to face, and unfortunately, people don't like to talk about it, but I believe so much in identifying the problem and then seeking solution. So, in some men who have diabetes, of course, diabetes affects the little blood vessels. So think about it. When a man has an erection, it's all blood vessels pumping into that what do you call it, organ. And but of course, in cases of diabetes, there is a serious impediment in the blood vessels. So the blood vessels are not either broken, or they're so weak and they're not able to sustain that part of the man to be able to perform his duties. Then in women, there are other women who have PCOS. People trying to get pregnant and they're not getting pregnant. They've been to the doctor's office for so many times. They're not, the doctors are not able to find any reason why they're not getting pregnant. Now, there's something called polycystic ovarian syndrome. Polycystic ovarian syndrome sometimes have been seen in people with diabetes. Okay, I'm not going to go into details with those topics. Probably talk about them later. But for the sake of this, I'm just going to keep it very, very short. All right. So talking about statistics now, the CDC estimates that nearly 1.6 million Americans have diabetes, including about 187,000 children and adolescents. Now, type 1 diabetes occurs in any age. Like I said, it doesn't matter your race, it doesn't matter your profession, it doesn't matter your lineage. But of course, that's the reason I'm having this little talk with you. Hopefully, you can learn one or two things that will enable you to look out for these symptoms and better manage the disease. All right, so I already talked about type 1 diabetes. It can be managed. Insulin, because your pancreas does not produce that insulin. So you want to get what you call an insulin replacement, into your system. Now, I already talked about type 2 diabetes. The key to managing type 2 diabetes is maintaining a healthy diet. Now, I've seen people who went from all the way diabetic to no diabetes at all because they had to involve themselves in exercise and weight management, in dieting and all of that stuff. Now, being fit is another way of managing diabetes, type 2 diabetes. All right, so I already talked about gestation. I'm not trying to take the whole day talking about this. If you're pregnant and you begin to feel any of the signs, or you go to the doctor's office and they tell you your blood sugar is high, please don't take it for granted, because it could actually affect you and the baby after the baby is born. All right. Now, there is a test for diabetes, a very reliable test. Now, for those of you who know about the blood sugar machine, there's some little, I have it, but I just forgot to bring it here, and I'm not trying to get up right now. So for those of you who know about diabetes, we have the glucometers. It's a little machine that tests your you prick yourself, get some blood, put it in a machine, and it tells you your blood sugar. Now, that tells you your daily blood sugar. It doesn't tell you your blood sugar over 1 month, over 2 months, over 3 months. The most reliable form of testing for diabetes is by using the hemoglobin A1C test. So what this does is it can identify even pre-diabetes. Now, I'm going to talk about the different levels of diabetes so you know where you belong, if you do belong there. So the hemoglobin A1C test, it tells about your blood sugar over about 2 to 3 months. So let's say you're fasting today, you've been fasting in the last 2 weeks, and then you decide to go to the doctor's office. The hemoglobin A1C is going to tell your blood sugar, not for that week, not for that day. It's going to tell your blood sugar for the last 2 to 3 months. And that is a more reliable way to determine diabetes. Now, this is relatively simple and it can tell you a lot. Like I said, the test result gives you a picture of your average blood sugar over the last 2 to 3 months. And then the higher the level is, the greater your risk for developing diabetes. So a few years ago, maybe in 2014 or 15, I had a hemoglobin A1C test and my blood sugar was, I think it was like 5.7. So I was pre-diabetic. Pre-diabetic means before diabetes. Now, it's the border between no diabetes and diabetes. So when you find yourself in that point, what do? All right. So the hemoglobin A1C test kind of tells you a lot about your blood sugar state, and it's more reliable. So if you're in doubt, it's time for you to go to your doctor's office and say, hey, I need a hemoglobin A1C test to check my diabetic status. Now let's see. So what do the numbers mean? Now, when it comes to the numbers, it's not a one size fits all kind of thing. I've seen very skinny people with over 7 point something blood sugar. I've seen very big people with maybe 4 or 5 blood sugar. So it's not pretty much a one size fits all kind of thing. But the goal is to get everyone below 7. The A1C tests are reported as a percentage, and the higher the percentage, the higher blood sugar in the last 2 to 3 months. Okay, so I talked about the numbers. So a normal blood sugar level or hemoglobin A1C level should be below 5.7. Below 5.7. So if you find yourself at a 4, at a 3, a 2, or a 5, for instance, then you're normal. You have a normal blood sugar. You're not diabetic. But that now, if you find yourself between 5.7 and 6.5, then you are pre-diabetic. You're just a stone throw before or away from diabetes. And it's time for you to start working on that before things get out of hand. Now, from 6.5 and then 7, and then I've seen people with 12 and 13 and 14. Now, that is very dangerous. Okay, so I talked about diabetes type 1, type 2, and I will talk a little bit about prediabetes. Prediabetes is a condition, it can lead to type 2 diabetes and heart disease. And you're at high risk for prediabetes if you're 45 and older, but I've seen young people who are pre-diabetic. If you're Black, Latino, American Indian, Asian American, Pacific Islander, if you have a parent, a brother, sister, family member who had diabetes, if you're overweight, if you're physically inactive, if you have high blood pressure, you're taking medications, if you have a low HDL and a high LDL cholesterol, if you had diabetes when you were pregnant, and then if you've ever been diagnosed with polycystic ovarian syndrome, you are at risk for having pre-diabetes and then diabetes. Now, there are different types of medications for managing diabetes. I'm going to talk about just a few of them, how they work. But now the goal of this is not to treat you. I'm not offering you medical advice. This is just what I call patient education. And I'm going to try as much as possible to bring you close to understanding what you need to do when you get to your doctor's office. So Basically, there are different types of blood sugar medications. Some of them work on insulin, they help produce more insulin. So if you go to your doctor's office and the problem is that you're not producing enough insulin, they can give you medications to, help the pancreas produce more insulin. Then some others prevent the production and release of glucose from the liver. The other ones act on the stomach enzymes. Some of them reduce gastric emptying. So some people, when they eat, the food breaks down real quickly and the pancreas is not able to catch up with insulin production. Some others help push the glucose into the cells, and some others also work on the kidneys, because the kidneys, the whole body system is structured in a way that it kind of is structured to maintain homeostasis. So when this area is lacking, this other area tries to make up for it. So the kidney, sometimes when there is not enough sugar, the kidney tries to hold on to some glucose. So but there are some medications that actually stop the kidneys from holding on to all that glucose. So it's kind of a balanced thing. So you need to find out what exactly the problem is before you start taking medications, and do not share anybody's medication. Someone else is diabetic and you are diabetic and you try to go borrow some of the medications. It doesn't work that way. All right. So I will talk a little bit about some of the complications of diabetes. I know I had them somewhere, but I cannot find exactly where I placed those. I can't find where exactly I placed the information on my PowerPoint, but I'll talk a little bit about diabetes, the complications of diabetes. Some of the complications include retinopathy. So think about it, the little vessels, the little blood vessels in the eye. What diabetes does pretty much is damage little blood vessels. It damages the blood vessels in the eye, it damages the blood vessels in the kidneys, it damages the blood vessels on the extremities, in the heart. So it's something that we need to take a whole lot seriously. If you have high blood pressure, it's time for you to also work on your diabetes, because what happens now, the blood pressure, the heart is pumping so hard, the arteries are expanding, they're stretching beyond limits, and then these arteries have already been weakened by diabetes. So that's the more reason why, if you have high blood pressure, if you have high cholesterol, if you have any kind of disease process, it's time for you to actually make sure that you do not also have diabetes in addition to it. Diabetes can also damage your kidneys. When the kidneys are not able to filter well because the vessels in the kidneys are all damaged, then there could be a lot of complications. And I've seen people who had diabetes and eventually had to be on dialysis for the rest of their lives because the kidneys shut down. Diabetes can also cause your wounds not to heal. Now, because the vessels, there are little tiny vessels in the extremities, especially on the feet, diabetes can destroy those vessels, and then people who are diabetic usually do not feel it when they have a wound. And that is the more reason we always encourage people, if you're diabetic, always ensure that you keep your feet clean. You don't try to cut your toenails by yourself. Go see a podiatrist. Do not try to, when you wear your shoes, buy shoes that fit right. Don't try to wear undersized shoes, because any injury to your extremities, to your feet especially, will have a hard time healing. And that is where the disease starts progressing, with poor wound healing and all of that. So what am I trying to say in essence? Diabetes can be managed. Diabetes can be taken care of. Good diet, good exercise, medication compliance, going to see your doctor when you need to. Check your blood sugar. Don't just eat and eat and eat and eat. Make sure you check your blood sugar in the morning when you wake up. Check your blood sugar in the evening. Whatever your doctor prescribes for you. Try to comply with your medication. Don't assume that other things will take care of it. Now, if you can exercise, try to exercise at least 30 minutes every day. I don't know how possible that is. I don't, but anyway, I just say it. So just do something. Although all you have to do is to decide to make yourself responsible for your health today. Now, decide to stay healthy. decide to eat well, decide to be active. If you're at risk, pay attention to living a healthy lifestyle. If you smoke, it's time for you to quit smoking, because smoking again destroys the blood vessels. And then you can actually return your blood sugar to normal by doing some of these things. Like I told you, I've seen people who have reduced their blood sugars drastically by weight loss, by eating healthy, and by living a more healthy lifestyle. But no matter what you do, the power to live your life is entirely in your hands. It doesn't matter what I say, it doesn't matter what your friends say, it doesn't matter what your husband or wife says. You have the power to live. You have the power to make the decisions that are needed for you to live, and not just living a very productive life. So thank you so much. I really appreciate your presence. Thank you for watching. Thank you for all the feedbacks. For those of you that take your time to watch this video, actually somebody told me that my smoke alarm kept beeping. I never heard it before that day. So thank you so much for those wonderful feedbacks. I appreciate it. My goal is to get better, and I know that the more feedbacks I get, the more I get better at what I do. So I really appreciate you all. Thank you so much, and do have a wonderful Father's Day. Bye bye.